In this video, we will show you how to use the history function on the monitor and the app to check the changes in patients' vital signs and understand what you can learn from them. The monitor continuously measures the connected patient's vital signs and stores these values. You can view the history of these vital signs, which can indicate whether the patient is improving, deteriorating, or stable. To access the history, click on the History button. You will see a trend of the vital signs, with the most recent measurements on the right and the oldest on the left. By using the Time Window button, you can select the time window you want to view, ranging from 8 minutes to 32 hours, allowing you to check recent or older events. When you click on Tabular Trend, you can see the patient's vital signs history in numerical form. Let's show an example. In this scenario, you can see that the patient deteriorated in the last days. You can see that the saturation went down and that the heart rate increased. You can see that the vitals are not yet alarming, but in the history it is clear that this patient is deteriorating. The history can provide insight into what happened to the patient between assessments. For example, you might not have noticed that the patient's oxygen saturation also drops regularly, but you can see it in the history. Here is another example. The patient's oxygen saturation dropped the previous day. The patient was put on oxygen, which increased the oxygen saturation. Since then, the saturation has remained within the normal range, so you might decide to remove the oxygen support. With the monitor, you can then check if the patient's saturation remains in normal range, or whether it starts dropping again and the patient needs to be put on oxygen. You can also check the patient's history in the app. To do this, open the patient's record and click on the history. Here, you can also change the time window you would like to view.